Will waiving rights to produce vaccines bring fast recovery from COVID-19 around the world? The fierce debate over intellectual property rights of vaccines continues as the United States pushes for a swift waiver to allow developing countries to produce their own doses for their populations. But the United Kingdom, Canada and European countries are unconvinced this would be an immediate solution, with the EU submitting a three-point plan to the WTO. It's clear that urgent action is needed to help developing countries vaccinate their populations and stabilise livelihoods from the impact of the pandemic on health and the economy. We discussed this today with Michelle Goodwin, Chancellor's Professor and Founding Director at the Centre for Biotechnology and Global Health Policy at the University of California, Irvine, and Jack Gao, Programme Economist at the Institute for New Economic Thinking, joining us from New York. Thank you both so much for joining us. And well, let's begin with you, Michelle. Now, we've seen a strong disparity between rich and poor countries in administering vaccines around the world. And, well, the COVAX alliance as well, it's not really managed to provide enough vaccines at the right time to the developing countries. And meanwhile, we're seeing countries with enough supplies employing what's being called vaccine diplomacy. Do you think the Western world has really failed to help developing countries as they were supposed to?
Well, they have, and we have to understand that during a pandemic that viruses are quite fluid, and if we are to address effectively a pandemic, then that means that the solutions also need to be as fluid as the viruses happen to be. And so global collaboration and cooperation is critically important in times of international crisis, such as what we've seen. And yes, it is true that countries from the West have failed, but the failure is not just at this particular moment in time where the Biden administration is looking for ways to be collaborative, but the failure is before now, early on, as the virus was raging worldwide. That was the time in which we really needed to roll out measures for collaboration and cooperation when the vaccines would be available. So in some ways, we are chasing our tails now, trying to play catch up to something that could have been planned out and institutionalized more than a year ago.
Well, it's a whole year that's been lost to the indecision and the lack of coordination between countries. And well, Jack, according to Oxfam, low-income countries are vaccinating at a rate of 62,000 people a day. And apparently at this rate, it's going to take them about 57 years to vaccinate their entire population. So what does this mean for developing countries? Which sectors of their economies have been hit the most due to the pandemic?
Good morning, Suyang. I think that heightened sense of hope, the light at the end of the tunnel, if you will, since the vaccine news has not panned out, certainly not for everybody equally. We know that the longer COVID circulates, the bigger its health and economic tolls, and the longer it will take for economies to recover. This is true in general, and all of these are much amplified in developing countries given the resource constraints and weaker safety net. If not addressed, these health and economic tolls are going to, spill back into the developed world in the future as well. Developing economies have been hit hard as a whole, given the large portion of the population working in informal sectors, the weaker digital infrastructure, which make working from home much less feasible. The service sectors, the kind of face-to-face interactions, physical marketplaces, manual labor, which make up so much in their income and livelihood, have been particularly suffering. So at this point, faster vaccination remains our only hope of a return back to normal.
And Michelle, now the United States had initially been pushing for a patent waiver for COVID-19 vaccine technology. But the UK and the EU, they're arguing that this doesn't immediately solve the problem. What's your view on this?
Well, I believe that it's all hands on deck. And as there are tensions now about which approach happens to be best in the United States, it's let's suspend the patents. And the EU, they're saying that that is not the best approach. But the reality is that in developing countries in the global south, there are real struggles to get people vaccinated. And as you've said, we're looking at almost 60 years, if we, even at the rate in which we're going today, before people could possibly be vaccinated. I think that the humanitarian thing to do is, in fact, to waive the patent features with this. That allows for some immediate action. And I think what's really important here is that we're dynamic and that we're innovative in thinking about myriad kinds of approaches here. I think one of the things that we see here is that infrastructure is a significant problem. What COVID has revealed are institutional and infrastructural problems that pre-existed COVID. And those are realities that could be addressed right now. They're certainly staring us in the face. And so I think that greater collaboration is important. I think that the waivers with regard to patents is, I think, a viable approach to take. It may not be the best approach, because there may be other approaches to be taken. And quite honestly, it strikes me as being quite inhumane, the level of suffering that we see globally, and the fact that this is being held up by concentrating on patent regulation seems to me to do a disservice, actually, to the human rights cause of what we're confronting.
And Jack, of course, there's been this opposition to the idea of introducing patent waivers to ramp up production of vaccines in developing countries. How would the rate of vaccinations affect the pace of economic recovery in developing countries? And do you think patent waivers are the best way forward?
So I agree with Michelle. Patent waivers may not be enough, but it's absolutely necessary towards speedy and equitable access to vaccines. In economic terms, we're in the middle of the greatest global public health crisis in 100 years. So I don't think it's time to have an extended debate on IPR, on intellectual property rights protection, especially given that many of these vaccine producers have been funded by public money to start with. Vaccine patent waivers will almost certainly increase supply at the margin at this point, which is exactly what we need. But patent waivers are not enough, like you said. We need a multifaceted and targeted approach to address the global situation as well as specific stress points. Rich countries and vaccine surplus countries will have to play a much bigger role, and all countries need to make vaccination a top priority.
And of course, Jack, vaccinations, they're only a part of the picture of this massive project of recovery that countries need to embark on. And while rich countries, they've rolled out massive investment plans to build back better from the pandemic. What kind of support do developing economies need at this stage to really stabilize their national economies as well as the livelihoods of their people?
Absolutely, Suyang. Rich countries took decisive actions in response to the COVID-19 crisis and have taken the opportunity to really roll out additional packages to shore up their economies. We saw from the latest World Bank upgrade to global GDP forecast, which in my view reflect precisely these factors. But developing countries have much less space to stimulate, even if they want it. They will be quickly penalized by international financial markets if they carried out discretionary spending policies. So for developing economies, vaccine policy truly is economic policy. But Suyang, there's another risk. Strong recoveries in so-called center economies are calling for exit of ultra-loose pandemic-era monetary policy, and in many cases, rightfully so. These policy changes will have negative consequences to developing economies, which are facing a very different reality. So we do have to worry about this double whammy for developing countries in a multi-speed global recovery from COVID.
So as you said, well, urgent action really is needed, and this is no time to be talking about intellectual property rights, but it appears that that's exactly what's going on. Michelle, it's clear that pharmaceutical companies aren't too happy about these patent waivers. Do you think they could be incentivized or convinced to share their technology?
Well, I think that Jack made an excellent point when he reminded the audience that these pharmaceutical companies have been supported through taxpayer dollars. right? The ingenuity behind what they are doing, the development and the research has been funded through government dollars. And so that is really important to keep in mind. And really, what we're confronting, and it's not just now, but we saw that at the height and peak of HIV and AIDS and the need for viral treatments in other parts of the world. What we see is that there's a need for revisiting the pharmaceutical relationship to how we think about healthcare access altogether. And this is just simply another example of it. We know that there is disparate pricing. The pricing, is aligned with maximizing where they can get value, but not necessarily maximizing where we can do the best work for people. And so, that kind of mixed alignment, people think about pharmaceutical companies almost as if they think about their doctors, that the incentives are ethically based and that the incentives are derived towards making sure that people are able to be kept in the best health. And what people don't realize is that these are for-profit businesses that are driven to maximize wealth for their shareholders. And that puts it in, I think, a brighter and clearer context. And that's also what makes it so challenging during a time of pandemic. That is to say, should those kinds of priorities have to step aside during a time in which you have, look in the United States, hundreds of thousands of people have died. I mean, in the United States alone, within the first 2 months of COVID, there were over 100,000 people who had died. Now, Americans often refer to these things as a kind of war. And if we could think about, a war like Vietnam, the Vietnam War lasted 19 years. There were 58,000 Americans who died. So in the first 2 months of COVID, there were more Americans who had died than in the Vietnam War, than in Afghanistan, in Iraq, with H1N1, Ebola, and Zika. And so given the gravity of this, it means really doing more than just leaning into the traditional legal frameworks that don't respond to the crisis at hand. We are in a crisis at hand, and that is the time in which we rethink these kinds of things. And I think it's really important for the public to be educated about the distinction between what pharmaceutical companies do and how they're aligned and aligned for profit versus being aligned for how we understand medical industries, which are about first, do no harm. Make sure that you provide the care that patients need. And if anything, what we actually need is a bioethics code of ethics, really, for pharmaceutical companies.
Well, leaders around the world are hoping to see some kind of breakthrough on this over the weekend, where G7 leaders of G7 countries will be gathering in southern England. And, well, this question goes to both of you, but let's start with you, Jack. What kind of progress do you hope to see from this G7 summit coming up over the weekend to address COVID-19 vaccine distribution?
Well, from the G7 finance minister agreement on global minimum taxes, we know that good things can happen in the world of multilateral cooperation. As to the summit this weekend, I'd like to see more commitment from major countries on vaccine sharing plans and commitment, more coordination with WHO as well as between countries on vaccine contribution, because you do want commensurate measures as much as possible. I'd love to see a timeline on global vaccination, much like what President Biden did for America by 4th of July, so that the developing world as well, and frankly, the world as a whole, could declare its freedom from the virus sometime in the next year.
Right, and of course, this week, UK Prime Minister Boris Johnson said that he hopes the world will reach, most of the world will have vaccinations by 2023. And, well, Michelle, how do you hope to see the issue addressed at the G7 summit over the weekend?
I agree 100% with what Jack has said. And what I hope that they do is think about the global world order. If we fail to address COVID and the dissemination of and dispensation of vaccines in an equitable and in an urgent way, what we'll see is really a tale of two different kind of economic infrastructures. where those who are in developing countries and in the global south suffer in ways that are magnified. And I think that what we're really seeing is that this is an opportunity to try to get this right. And if we get this wrong, the level of suffering is something that we will not have seen for decades. And as Jack mentioned, it was 100 years since we had the 1918 version of a virus that went global. But here I am deeply worried about what this means for economies and for countries that have relied on tourism, countries that were just beginning to get fully established, countries where women were beginning to get a foothold. If we fail to act collaboratively and in an urgent way with timelines, I completely agree with you, Jack, then we'll see lots of efforts that have taken place in many other kinds of ways through UN platforms and other ways stymied for quite some time. And so I think that there's a momentum that we need to have with this, and we need to not lose sight of the kinds of progress that was taking place in many of these countries prior to the pandemic.
Well, hopefully the G7 leaders can take hold of this momentum and really put it to good use. And well, this is where we're going to have to end the interview today. But that was Michelle Goodwin, Chancellor's Professor and Founding Director of the Center for Biotechnology and Global Health Policy at the University of California, Irvine, and Jack Gao, Program Economist at the Institute for New Economic Thinking. Thank you both so much for your insights today.
Thank you for having me.
Thank you.
And to our viewers, as always, thank you very much for watching.